Hi, I'm Richa Thakur. I'm a first-year Hemonc Fellow at Northwell, and I'm one of the fellows on Fellows Forum. So today I'm really excited to introduce you to Dr. Nida Khan. She's a third-year medicine resident at Northwell as well, and in July, she's going to be starting her first year of a joint medical oncology and palliative care fellowship in Ohio. So I'm really excited to bring her because these programs are so new, and I really can't wait for you guys to hear more about them. So welcome, Dr. Khan. It's so great to have you.
Thank you, Richa. Thanks for the great introduction. Pleasure to be here.
Oh, I've been looking forward to this ever since you matched, so I'm really excited. Could you introduce yourself and tell us a little bit more about your interest in oncology and palliative care?
Yeah, of course, definitely. As you said, I'm a PGY3 internal medicine resident currently at North Shore LIJ in Manhasset, New York. I grew up in the New York area, and in terms of what brought me to oncology and palliative care, I think it was a long time coming, thinking about it. I went to medical school at Temple in Philadelphia, and that was like kind of my first exposure to oncology and palliative care, just kind of serendipitously. A lot of my core medical school rotations ended up being at the cancer center at Temple. And so I was exposed to that cancer patient population, and I was exposed to the unique type of palliation that they require. And so when I entered internal medicine residency, I knew I wanted to do oncology and oncologic care for sure. The palliative care part, not so much until I went through residency. And I realized that oncology and palliative care are so connected and interwoven. And I was surprised to see that a lot of times there's not much training otherwise. So like if you're oncologists who are trained in, these traditional kind of fellowship programs or hemonc programs, they probably don't get as much exposure to palliative care as you would think so. And so I knew that that was something that I wanted to do, just to be the best oncologist, the best physician, the best, palliative care physician I could be. And so that's kind of what started getting the wheels turning on what I was looking for in my training and what I wanted to pursue. And that's kind of how I came across wanting to do both of these fellowships.
So that's really good to hear because I definitely agree. I mean, in medical oncology, we have to do a lot of primary and secondary palliative care, but that formal training is something you really can't get outside of a palliative care fellowship sometimes. So I guess one thing I wanted to ask you was a lot of fellows choose a very traditional like a 1 year palliative care fellowship or a joint Jerry Pal fellowship
Mm-hmm.
versus a 3 year HEMONC fellowship. And these two, like some of these new programs that combine palliative care with hematology or medical oncology are so new. What made you consider doing like a joint program versus one over the other?
Yeah, that's a great question. And it was something that I really had to sit down and think about. And as I said, when it came time to apply, I knew at that point that I wanted to do palliative care and I wanted to do oncology. And it was really just the order of them and what I thought was the best for the type of training that I saw for myself. And so um, when I applied, I knew that the palliative care portion it would provide me the foundations and a different type of outlook for the oncology part. And so I came in with the idea that, you know what, I'm going to do the palliative care year first so that I have this type of palliative care foundation that I can apply and see my oncologic patients through that lens, which I think for me was very important. And it's just how I wanted the type of physician I wanted to be. So when it came time to applying, I applied mainly to palliative care programs, plus these few unique combined programs. And as you said, there aren't many of them. Yeah. So there's only like currently for this past cycle, there were only, I believe, four. And I believe there's a couple more opening for the next cycle. So it'll be up to, I think, like 6 to 8 new ones, or total for this next cycle. So there's very few and far between. And so and each program is unique. Each program has their own little timelines and board certifications and all of that. And so I had to read about it. And a lot of these are brand new, right? And so a lot of these times you're going to be the inaugural class. You're going to be the one that's kind of leading the torch in this kind of new field with these new programs. And so you also have to think about that. Like, is that something you're comfortable with? And so I thought about all these things, and I knew that for me, I wanted that palliative foundation regardless. So when it came to applying, I applied to mainly palliative care programs, looking at unique programs that offered the palliative care training that I wanted, plus these programs, these combined programs that I knew, and from reading about them, were able to offer the type of palliative care and oncology training that I was looking for. So that's kind of how I approached it. And it was a lot of research, and it was a lot of talking to people, including yourself, and just kind of figuring out what I wanted. And yeah.
I think you made a very tough decision, but knowing you, this is such a good fit for you.
Mm-hmm.
And one thing I've noticed is these programs are so new. When I applied, they didn't have these. They had been in talks for a while, and I think your class was the very first class where they had the 4 programs, right?
Yeah, exactly. And so, and in some ways you're in a niche. And so there's these programs are part of like the ASCO's Communities in Practice initiative. And so I went to a lot of these forums and like spoke to a lot of on these the Zoom meetings like this, where people talk about how they foresee these programs and how they see professional development and careers forming from these combined programs. And for me, I think I really connected with that. There's a unique and small community on Twitter that are just so interested in these combined programs. And through talking with them, I was able to talk to some of the people who matched in the other programs through Twitter and talk about our shared interests. And I think that when you meet like-minded people like that, and you're in that kind of that bubble of people who have the same interests as you, it really helps, and you just feel more connected to, and just more sure that this is the right path for you. And I think that for anybody who's looking for this as like a potential to look into these programs as a possibility for themselves, I think you'll feel it, and you'll connect to it when you talk to the people who are interested in the same thing, and you'll feel it for sure. And that's how I felt it.
That's really good to know. So I think most of the people that listen to this podcast are usually medical oncology fellows, some attendings, and then also some residents that might have interest in palliative care.
Mm-hmm.
So what would you recommend for them to look for if they wanted to do more palliative care, either like in terms of applying for a formal fellowship or rotations, or any other advice you would have?
Yeah, certainly. As I said before, when I was looking at palliative programs and what were important to me, I think a lot for me was programs that were really big on symptom management and making sure that their trainees were comfortable with that. And because I know that as someone who sees the bulk of their practice being oncology with symptom management, I wanted to have that foundation. And so when you look at these palliative care programs, some of these programs, and each program has their kind of own niche, right? So some programs are more hospice focused. Their focus is more on training patient or trainees that are going to look forward to becoming hospice directors, or in that hospice kind of world, that hospice realm. Others are focused more on symptom management, making sure how to control cancer related pain, the symptoms that come with cancer. Other ones are more driven by, some of them have palliative care units, and trying to make the type of physician that is able to run a palliative care unit, inpatient palliative care units, some have all three. And so really, I was looking at all of those for sure, but I think for me, I was looking mainly at programs that would give me a great foundational training in symptom management, so that when I am treating these patients, I feel really comfortable in managing cancer-related pain. And making sure that if I'm not completely comfortable in managing, that I have the tools to like look that up, because I have this great foundational training in palliative care. And so that's what I was looking for. And I think it's different for everybody, but coming from somebody who is, or like speaking to a group of people that are interested in oncology, I think a lot of that for like-minded people is symptom management, right? So that's kind of what I looked for. And as I said, every program is different, and you really have to do kind of your research to see which ones fit that mold best.
I think you brought up a very good point too, because palliative care is really brought up with the needs of different groups, right?
Mm-hmm.
So um, it's mostly associated, like it's most closely associated with hospice because that's what people think. But there's such a huge need with geriatrics,
Mm-hmm.
some of it in the ICU, and then also the oncology realm. So making sure that there's a good cancer basis and symptom management, of course, is a
Yeah.
very good point.
Yeah, 100%. And palliative care itself is a field that you have people coming into it from all different specialties, right? Internal medicine, emergency medicine, pediatrics, people who are going on to surgery or home critical care. And each one of those people have their own type of reasons for doing palliative care, but also because palliative care is so applicable to all these specialties. And I think that's what makes it so great, and only can be beneficial for people who are interested in pursuing that type of training.
Absolutely. Do you have more specific interests within palliative care and medical oncology in terms of like research or patient population or advocacy?
Yeah, for sure. I ever since kind of my whole kind of arc in medical school, I think part of what I'm interested in my whole medical training is global health. Before I went into medicine, I worked at like the United Nations for a bit. So global health has always been something I'm super interested in. Um, and part of that, now that I'm going into palliative care and oncology, is seeing how that applies to global health. So part of the patient population I'm interested in is the global health population. And so I recently, back in February of this year, had the great opportunity to go to Uganda, specifically southwestern Uganda. And I worked for a month in a rural government hospital there. And I worked really closely with the inpatient wards, and also palliative care and oncology. And um, the needs and resources are completely different than the States, but I just really love that patient population. I really love how palliative care and oncology is different in different areas, and then how we can kind of tailor what we learn to that patient population. And so that's something I'm interested in and exploring more about. And I've spoken to some of the Ugandan Palliative Care Association and seeing how their needs are different than here. And that's just like something that I think will always be dear to my heart, and something that I really love, and something that I'm working on as well in the palliative care realm.
Absolutely. That sounds like such a life-changing experience.
Mm-hmm.
I think a lot of people don't have that opportunity to look for global health opportunities, but
Mm-hmm.
for people that are interested in global health, do you have any recommendations, advice, or resources?
Yeah, for sure. I think I got lucky because my residency has this partnership in Uganda. So I think the first place to start would be looking in your training program. I'm sure that there's somebody in your training program that is involved in global health at some point and can offer some insight. Um, if not, then there are a whole bunch of associations. There's actually, as I mentioned before, there's these ASCO communities in practice, and one of them is a global oncology group that I'm a part of. And so a lot of those people there's always posts on those about people doing work across the world and, in different countries. And you can definitely connect with people that way. And there's a lot of programs across the world, and there's no shortage of it, where there's these kind of longitudinal type of clinical work that you can do depending on the region you want to be in. And so I think it'll take some research, but those programs are out there for sure.
No, thank you for sharing that, because I think like these areas of oncology, palliative care aren't talked about enough, and
Mm-hmm.
making sure like people have exposure to this is very important. The last question I have for you is for any of our like viewers that are interested in applying for a joint like palliative care with either hematology or medical oncology program,
Mm-hmm.
do you have any advice specifically for those, like for the
Yeah,
application process?
sure. Yeah. Uh, I think that the first thing is to look into why you're applying to these programs and what's important to you about it. I think that if you have a great foundation and a great reason for that, it can really show when you're interviewing, when you're talking to, these program directors. Because when I interviewed for these programs, you interview with both the palliative side as well as the oncology side. And so you really need to be able to say why you like both parts and what you're going to do with that training. Um, I think also doing a lot of your own research to kind of see what type of training you foresee for yourself, right? Because as I said, this is a kind of a new field, and it's exciting, it's new, and you a lot of times are going to be the trailblazer, right? And so you can really kind of mold the future of this field depending on how you foresee your training going. And so those new ideas and those that outlook, I think, is something that can definitely be valued. Talk to people, really put your questions out there. There's way more people than you think that are interested in the same thing. And if you have a question, I'm sure it's been asked before. And so I've really talked to a lot of people to make sure it was the right thing for me and to see what's out there. And I think that if you do all those things, then you'll be great.
Well, I really appreciate you taking the time to meet with us. Thank you so much for being here. And this was such an informative experience for like so many of us, especially because these programs are so new. And it's really like lovely to hear how you looked into these programs in so many different areas to really find like the perfect niche for you.
Of course. Thank you for having me. It's a pleasure.